Hello guys, in this video we will discuss about the question we have asked about tetanus prophylaxis in WhatsApp group. So coming to the question, a 12-year-old cyclist had avulsion injury to leg and presented to emergency. On history, he has taken last booster dose of tetanus vaccine at 9 years of age. What is true regarding his tetanus prophylaxis? So, the options are given as give both TT vaccine and immunoglobulin, give only tetanus toxoid, no need of vaccination or immunoglobulin, give only immunoglobulin. So, we will discuss some important things and later we will solve the question. So, whenever question asked on tetanus prophylaxis, always ask three questions. First question is first you examine the wound and categorize this wound into clean wound or not clean wound. We will discuss later what are the things will comes under not clean wound. So, next question you should ask whether the patient completed primary vaccination of 3 doses with age appropriate vaccine. Okay. And the third question, if the patient have taken vaccine, okay, then ask about last dose of vaccine. Okay, ask about when was the last dose of vaccine taken. Okay. Coming to the flow chart which will help us to solve this question. So, after you examine the wound, you have to categorize this wound into clean wound or not clean wound. Any other wound that is not clean will be discussed here. So, not clean wounds are contaminated wound with any soil, feces, saliva or urine. Okay. And the next not clean wound is penetrating wound. Okay. And the third wound is any avulsion injuries, any crush injuries. Okay. All these comes under not clean category. So, first we will discuss about the clean wound. Our approach to the clean wound will be, if the wound is clean, and ask about the primary vaccination history. If the patient have not taken or otherwise not known about the history of the vaccination, you should always do vaccination of 3 doses as per schedule. Okay. If the patient have taken vaccination otherwise, okay, then you should ask about last dosage of booster dose. Okay, last dosage of booster dose. Then if it is within last 10 years, then he doesn't require any vaccination. Okay. Or otherwise, if the patient have not taken within last 10 years, that means you have taken vaccination more than 10 years back. So, this patient need vaccination with booster dose. Okay. Remember this thing. And let us discuss about the not clean category. You examine the wound and it comes under not clean category. So, now you ask about the primary vaccination history. If the patient have not taken any vaccine, then you should do complete vaccination along with immunoglobulin as per weight. Okay. And for suppose if the patient have taken vaccine already, then you should inquire about last dose. When was the last dose taken? So, if the last dose was taken within last 5 years, then this patient no need of any vaccination, and ask this patient to repeat vaccination after 10 years of last dose. Okay, after 10 years of last dose. And for suppose if the vaccine was taken more than 5 years back, then this patient need vaccination. Okay. Coming back to the question, the patient age is 12 years, okay, and he have taken vaccine at 9 years of age. So, last dose was taken 3 years back. Okay. And one more thing, patient had avulsion injury. So, wound will comes under not clean category. Wound will comes under not clean category. Wound will comes under not clean category, and primary vaccination has given, and then the last dose was taken 3 years back. And what we were discussed in the not clean wound, and we have to follow this one. Patient is having non clean wound and he completed the primary vaccination, okay, and last dose was taken within 5 years. So, this patient does not need any vaccination. Okay. Coming to the options. So, give both TT vaccine and immunoglobulins? No, this is wrong option. Give only tetanus toxoid? No, this is also a wrong option. No need of vaccine or immunoglobulin? Yes, this is correct. And give only immunoglobulins? No, this is also wrong option. So, correct option is option 3. So, guys, this is the explanation. Thank you.